Hello, my name is Dr. Cliff Eke. I am an attending surgeon at Kaiser Permanente Hospitals in Fontana, Ontario, and Riverside, California. I'm also an assistant clinical professor of surgery at Loma Linda University School of Medicine in Loma Linda, California, as well as a past president of the American Cancer Society California Division. Today, I'm pleased to talk to you about colorectal cancer. As you may know, March is the National Colorectal Cancer Awareness Month, so it's appropriate that we talk about this and find ways we can help to not just prevent colorectal cancer, but to find it when it's early. So first, I'm going to define what colorectal cancer is. Then we're going to talk about some facts and statistics about it. Then we're going to go over some risk factors. After that, we'll talk about the symptoms to look for. And then we're going to talk about diagnosis and screening tests, and also give you some links where you can read some more online. So first of all, colorectal cancer is a disease of the colon and the rectum, which are part of our digestive system, the lower part of our intestines. And sometimes people just say colon cancer, but it's usually the colon and the rectum. Large intestine, and then the rectum is the part that connects that large intestine to the anus, where this stool comes out from. As far as facts and statistics, according to the American Cancer Society, in 2023, which is this year, there will be about 153,000 new cases and sadly 53,000 deaths. Average lifetime risk of getting colorectal cancer is 1 in 24 people. And the screening is the number one method to prevent colorectal cancer or to find it early when it's curable. And when found early, survival of colorectal cancer is greater than 90%. So that's why it's important for us to screen, and that's why I'm making this video for us. So now I'm gonna go over the risk factors of colorectal cancer. Anyone, male or female, can get it. And interestingly, most people are asymptomatic, meaning they don't have symptoms. Remember that, I'll mention that again. However, so most people are asymptomatic. So the only way to know if you screen, now we're starting at age 45, it used to be 50. And actually I was instrumental when I was the president of the California Division of the American Cancer Society in 2011 to 2012, starting to push for the screening tests to start at age 45 instead of 50, because I was seeing young, healthy, especially black athletes that developed colorectal cancer below the age of 50. But going forward now, the symptoms we can talk about, you can have blood in the stool. Now, sometimes we get bright red blood in the stool, occasionally. Most of the time it's due to hemorrhoids. But if this persists or you have dark stool, then we need to be screened. Also, you may not see this too if you're anemic or you're getting very weak. Of course, we talk to your health care provider. This may be also a sign or symptom. Then also if your bowel movement is unusual, so you keep having diarrhea or you keep having constipation, that's not just temporary, then you need to be concerned. This may be a symptom of colorectal cancer. Now, one of the most common symptoms actually is pain. So abdominal pain or belly pain that doesn't go away and continues, then it's actually late. So we want to find it before that happens. But like I said before, most colorectal cancers are asymptomatic, meaning they have no symptoms. And that's why it's important to screen. Now, there are some risk factors involved, age being one of them. Like I said, 45 or older, we start screening. Other risk factors include inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. If someone has a personal or family history of colorectal cancer or polyps, that makes them higher risk. If somebody has some genetic problems, specifically what we call familial adenomatosis polyposis syndrome or FAP syndrome. The other one is hereditary non-polyposis colorectal cancer syndrome or Lynch, Lynch syndrome. Then race is also important. Black folks or African Americans like us as well as Ashkenazi Jews, are at higher risk than other races. What we're talking about, started screening at 45, is actually for average risk patient, which means patient has no family history or any of the things that I've mentioned, and they are fine. Even with that, and they're asymptomatic, they need to start screening by age 45. If they have these high risk features that I've said, then they may start screening earlier based on their family history. So, how do we diagnose or screen? We'll go to diagnosis and screening now. There are several things we can do. We have options, actually, which is good because not all screening tests are available everywhere. First is the stool tests. There's something we'll call the fecal immunoglobulin test or FIT test. Actually, I have a sample here. This is a FIT test. And usually your healthcare provider or insurance is covered. We send it to you in the mail. And when this is the mail, you can send it, it's prepaid. And this is actually very easy to do. And you do it yearly, it's once a year. And here is a picture. Basically, you go into your privacy of your bathroom, you get a sample on the stool, put it back in this kit, and put it in the mail. Where is that mail? Yeah, put it in here, seal it, and mail it to your mail health provider, and they will test it. If it's positive, then they will have you do a colonoscopy. But if it's negative, you're good for another year. So one is the stool test you do yearly. There's another stool test which is not as widely available called the FIT DNA test. So it combines the FIT test which I showed you plus looking for DNA of abnormal DNA in the stool. So that's one test, the stool test. The second test is flexible sigmoidoscopy, which is a scope that's put in there through the anus, and it looks at the lower third of the colon. And this can be done every 5 years. Then colonoscopy is a scope that sees the entire colon, and this is done every 10 years. And it is the gold standard of screening. And if they find a polyp, then they'll do it sooner than the 10 years. But if it's clean, you're good for 10 years. And there's another one which is called CT colonograph or virtual colonoscopy, which can be done every 5 years. And this is where the radiologists, they do it like a CAT scan or CT scan, and they can see the colon and the rectum, and they get image of them. If there's any abnormality there, then you do a colonoscopy. But if it's normal, then you can do it again in 5 years. You may ask, well, which test is the best for me? Which one is right for me for screening? And which one should I get? Which is a good test. My patients ask me this. And I tell them it depends. First of all, you talk to your healthcare provider and see, based on your risk or lack of, which one they will recommend. But also, what I say is it also depends on your preference. If you don't want to do the prep for the colonoscopy, for example, and you prefer the FIT test in the privacy of your home, it's okay. It depends on your medical condition. Also, if you have a personal or family history of colorectal cancer, and of course, if there's genetic syndromes like we mentioned, that may affect the type of test that you should do. And finally, if there's the availability of the tests, because some parts of the world or some localities, not all tests will be available. So that's why we have a choice. But I think, or I tell my patients, the best test, the best screening test is the one that you get done. Of all this, just get one done, please, so that we can find polyps or early colorectal cancer and take care of them when it's curable. And you have to be your own self-health advocate, and also for your family. So if you talk to a provider and they don't order the screening test, go see another provider and get a second opinion and do it. And you can find more information on American Cancer Society, cancer.org, cancer.org. So before I conclude, I want to go over the key information we talked about today. Please remember, number one is that colorectal cancer is preventable. Number two is screening saves lives by finding polyps or early cancer and it's removed. And when it's removed, then survival is over 90%. Number three, start screening at 45 years of age for average risk person. If you're higher risk, you may have to start early. Depends on where you fall in those risk factors we discussed. To also prevent this, we need to eat more plant-based diet, like vegetables, salads, fruits, nuts, and less red meat, okay? And in Before closing, I want to show you what we do locally. We support our local colorectal cancer movement. And here it tells you that attention, this is that 45 is the new screening age, okay? It's no longer 50. And also, I like this one. It says, but. It's funny, but seriously, get screened. Again, talk to your healthcare provider, know your risk, do it where you can find the polyp early or the cancer early, and most of all, colorectal cancer is preventable. Thank you for listening and take care of yourselves.